like for us to go ahead and get started. We'll start with we'll welcome everyone. Thanks for coming. We'll start with the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to start with a moment of silence and reflection. And think about and accept the responsibility that we have here before this board for decisions that are made that can influence health, safety, and well-being of children, families, youth, and older adults across Union County. May we approach tonight's work with humility, with wisdom, and with a commitment to the public good. Let us remember that those in our community who are struggling, those who are facing illness, poverty, disability, addiction, loneliness, and those in crisis, may their experiences guide our discussions. May their needs remind us of why this work matters. Grant us the patience in our dialogue, clarity in our thinking, compassion in our decisions. May we listen respectfully to one another and remain focused on solutions that strengthen our community as a whole. As we express our gratitude for coming here tonight, being able to serve as providers, advocates, and families who work here every day, those who do great work for this county, we thank them for their dedication, and it's the foundation of the system that we serve under the Consolidated Human Services Board. May this meeting be guided by integrity from all, collaboration from all, and a shared commitment for well-being. Amen.
Amen.
We're going to start with approval of the minutes. Everyone had a chance to review those? Motion from Dr. Wise, thank you. We have a second? All those in favor? All opposed? The minutes have passed. Thank you very much. Next on the agenda is the approval of tonight's agenda. We have a motion for that. Does everyone have a chance to review?
Make a motion to approve the agenda.
Thank you, Dr. Rice. Do we have a motion to approve the agenda? Have a second?
Second.
Susan? All those in favor, say aye.
Aye.
All opposed?
So it is approved. Thank you.
Next up is the Executive Director's Report.
Good evening. Tonight I have the pleasure of bringing to you all the opportunity to review two applications for participation on the Consolidated Human Services Board. Both of those are for existing members. So if an existing member is part of this, they will not be eligible to vote in this process. But we have two applications, one for Amy Dickey and one for Randy Smith, filling the Consumer of Human Services and other person position for second terms. And so if you all would like to take a look at those and consider them for recommendation to the Board of County Commissioners for reappointment, that would be welcome. And any questions or comments or concerns?
Motion to approve it together.
You can. Oh, actually, you know what, do it separately if you don't mind. Just say,
Motion to approve Randy Smith.
I second.
All those in favor?
Aye.
Any opposed? Randy Smith is approved for a second term.
I make a motion to approve Amy Dickey.
do we have a second for that motion to approve Amy Dickey as a recommendation?
All those in favor? Aye. All opposed? No opposition? Both are approved.
Great, so we will move that forward to the Board of County Commissioners. And just for reference, because it has come up recently, if you have an interest or know of someone who has an interest in applying to the board, you can go on the Union County website and under boards and committees, if it's unioncountync.gov, and under boards and committees, there is a section that has the application and it has information about the current vacancies, and then just a Word document that is the application. I know you all have filled that out, but it may have been a while, and so if it has and you know anyone that might be interested in a position that is currently vacant or that is going to be vacant, Dr. Weiss, thinking about you specifically, we would love to have somebody already in queue potentially to take that, or at least for consideration, to take that slot.
Next up, we have the division report.
It's going to be Tracy and I. We are tag teaming this as we are the co-chairs of your local child fatality prevention team. And each year we get to talk to you all about the most terrible meeting that we attend every quarter. And that is our child fatality prevention team. Tracy's going to explain a lot of the background and ins and outs, but to put it in the most layman terms, every quarter we get together and we review child deaths from that same quarter from the year before. We go through them, we see if we can figure out trends, if there's anything that could have, should have, would have been done to make a difference, and then we submit to the state our recommendations for those. So I'll let Tracy give you a little bit of the whole team background, because a lot of things have changed with our team over the last year. There is a handout also, sorry y'all.
Yeah, we provided a handout and a paper copy of the report just for your information. Some of the processes associated with the child fatality team have changed recently due to some legislation. Legislation was passed in '23, went into effect in '24, and it adds a lot of detail, data collection, and specifics around how the task force will operate, not only at the local level, but at the state level. So it's a good thing. It's a good thing to capture more data so we can dive into more detail of the cause of the deaths of these children. But at the same time, it is quite a heavy lift for the teams that are serving on the committees, and it's going to have an impact long term as far as navigating the new software system, reporting, time set aside for the reviews. But I just wanted to talk with you a little bit about the composition of the teams and also what the different levels of reviews mean. So just as a snapshot, in 2025, that's the report, although we're documenting the deaths that occurred the year prior. The Union County local team reviewed 19 child fatality cases, 4 of which met the requirements for escalated reviews. The North Carolina prevention team at the state level requires escalated reviews for specific categories of child deaths, and these reviews address complex cases involving child maltreatment or prior child protective services involvement. So the mandatory reviews for child fatalities fall under specific categories as laid out in General Statute 7B-146.5C. And those include the following: undetermined cause of death, unintentional injury, violence, motor vehicle accidents, deaths related to child maltreatment or child deaths involving a child or child's family who is reported to or known to Child Protective Services that meet some specific criteria in the law. Sudden, unexpected infant deaths, suicide, deaths not expected in the next 6 months, and additional infant deaths based on criteria set aside by the state office under legislation. So for deaths related to child maltreatment or involving applicable parts of the article of the law. So for the specifics of that, one is the decedent, the child that's passed, was known to be reported as being abused or neglected under General Statute 7B-301, regardless of the disposition of the report. So even though the case may be investigated and dismissed, it would still meet that requirement and be investigated at the escalated level. There was a known report involving child abuse or neglect under that same statute within the 3-year period preceding the time of the child's death that involved the child's family, regardless of the disposition of the report. Again, regardless of whether or not, the abuse was substantiated or dismissed. And then 3, the decedent or decedent's family were involved with Child Protective Services within 3 years preceding the child's death. And then finally, available information that the county may access, social services, public health, indicates a possibility that child abuse or neglect, as defined by that general statute, may be a direct or contributing cause of the child's death. So as Ashley mentioned, these are very, very difficult meetings. We're very grateful for those in the community that, are willing to serve. It's a difficult time when we get together. So we're happy to answer any questions. Just know that the reporting, there's an annual report that's made to you all and to the Board of County Commissioners. That copy of that report is also sent to the state for documentation as well.
So as part of our reporting out to you all and in our team meetings, first of all, just to give a shout out to Eric. Eric serves on this Human Services Board, but I don't know if y'all know this, he also serves on our Child Fatality Prevention Team. So thank you for serving on both of those with us. He is actually in the role in regard to his work that he does with EMS. So through that, at each meeting, after we've reviewed the case, or during review of the case, we try to come up with, as I told you earlier, our own recommendations for systemic improvements that we think could prevent this type of child death in the future. And so as part of our report out annually, we send to the state this list of recommendations again, but we also report that out to you all and to the Board of County Commissioners. So I'm going to, I know that you can read, but I'm very proud of the work that we've done around this over the past year. And so I'm going to go through the recommendations that we made over the past calendar year for the cases that we reviewed. First of which was we requested someone look into legislative change for juveniles to receive escalated penalties for repeated gun offenses. Felt like DJJ wasn't necessarily taken as seriously as we wanted them to, and we thought that could help prevent other deaths of children. Increasing funding to the Department of Juvenile Justice to drive more effective treatment options. They are way underfunded. Increasing resources in schools to focus on prevention services and linkage to additional support and resources. Developing targeted prevention programs for elementary and middle school. Recommended that the North Carolina Department of Transportation conduct an evaluation of a certain section of road. The NCDOT and the Regional Traffic Engineer's Office conducted a formal investigation to identify potential safety enhancements following our recommendation. The Regional Child Welfare Consultant is trying to obtain approval from the state office to change the current district attorney referral form. This change would allow district attorney's office to track specific patterns, thus strengthening the community's approach to the safety of children by being more coordinated with complex cases. We asked for more gun safety training for homeowners who have children and at-risk children. Took steps to involve the DJJ to strengthen the community's approach for adolescents involved with DJJ. And the state should create some educational materials involving the dangers of placing children on farming equipment. That was directly related, all of these are directly related to ones that we reviewed, but that one as well. From that, we took it a step farther, as we are tasked to do in our role on this team. And we came up with what we felt like were critical resource gaps in the current system and in our community. There was a lack of available or adequate services for some of those things that were referenced earlier in our recommendations. Limited services for youth with co-occurring mental health and developmental disabilities. There's limited access to health care and lack of health insurance. You either meet the Medicaid guidelines or you hope that your parents or the family has insurance related to their job, because it's really hard to get it if you're in between those. And limited community awareness of existing services, just getting the word out about the things that we actually do offer so that people know how to utilize and access those. And then insufficient financial resources, I think that will forever and always be on this report. I don't know that there would ever be enough funding to get us out of or to prevent all child deaths, but there are some things that we mentioned in the recommendations where funding would definitely be helpful. Specifically, I know I'm biased, but in regards to DJJ, I think they could really use it. So those are the recommendations that we made based on this past year's cases that we reviewed. Tracy, was there anything else you wanted to add in regards to our report for you all?
I don't think so.
Does anyone have any questions about our report? I don't know that it has to be voted on to be approved, just to acknowledge.
Endorse it.
I just have a question. I know you used to do a survey through NC State. Is the new platform now that'll take that over as the new form of that?
It will take that.
And so will it be a dashboard then now?
We'll see. I think they've talked about that, and I don't remember if it specifically stated that in the legislation, but I know that that's what they're working towards with almost everything at HHS now.
Okay.
I will add that the reports that we submit across the counties to the state new department that's been created, those reports are summarized and also sent to the legislature as part of the new legislation.
Yeah, and I believe they do a statewide annual report as well based on all the county's reports that are submitted.
And it's still consolidated child fatality and child welfare?
So it used to be two different ones. It used to be child fatality prevention and community child protection team, and we had a combined team. They've just formally combined that across the state, so yeah, now everyone's is together. So we also at these meetings review difficult child protective services cases so that we can seek multidisciplinary input from everyone on the team, and that outside perspective is very helpful on some of these cases where we feel like we've just done as much as we can to figure out how to help them. We can get outside perspective from folks like Eric and other team members to help us kind of see other things that potentially we could do with the case.
You know, that's another way that Union County is unique, that actually is not required, but it's an extra step that we take to talk through some of these more difficult cases. I think it also gives the folks that are involved, the social workers and so forth, a chance to talk through these things in a confidential way, to get feedback and work through some of the challenges.
Are these reports available to the public?
This is available to the public, but none of the data that's behind it. Yes, this was given to you, you're a public board, and a copy will be given to the Board of County Commissioners.
And then statewide, they'll compile all 100 counties and put together a state report.
Can you remind me how those numbers compare to last year's?
I would love to do that in a follow-up email.
Sounds good.
I can't remember.
Sounds like an increase, but I'm not sure.
Yeah, I wouldn't even guess.
There will be some changes with that, just because they did change some of the criteria, particularly for infants that, passed for, birth defects or something like that. So they made the age a little increased the age a bit for an infant. So just so you know that we may not be comparing apples to apples.
Do they still have that requirement? I know it was tricky to have someone, to try to have someone with lived experience in the two domains.
Yes, and we have had a member of our team. She recently resigned. She'd served on our team for several years, so we're currently looking for a new member to our team who has lived experience in that their child has passed, and so they can bring that experience to the table. It's one of the most difficult positions on that team to fill. I mean, you all understand that. But yes, we are actively looking for someone to fill that position.
Are there any more questions? Next up is the overview of Human Services business operations with Ms. Moore.
Presented to y'all on the, can you hear me without the mic? No. So I'm not sure if I've had a chance to present to y'all on business operations. So Janet asked me to present tonight, so I'm happy to brag on my team. I think I have some fantastic talent that does a lot of work across all of human services. So, this is the family photo. This is our org chart. As you can see, it's pretty big and we cover a lot of territory. And the whole reason skipped one. The whole reason that operations exists is to help operationalize and support all of the rest of human services that are front-facing. We do support several programs and services within our own org chart, but we're to be a strong foundation for all of our clients and employees, and a lot of times our clients are other employees. We're established infrastructure of managers and teams that focus on the front of the house and the back of the house and all the support that happens in between. And we have the workflows to engage both the monetary, fiscal, and human resources to ensure that quality services are accessible, safe, and delivered in an efficient, culturally competent, welcoming manner. So that's our mission and vision that we try to work through. By function and staff, there are 66 FTEs across all of across business operations, working in 12 programs and services. The team members on this slide are my direct reports. Sarah Castrian is the admin 3 that supports operations, but she really does work across all of human services. A lot of it is in Laserfish and workflows and surveys and data collection and things of that nature, but she supports wherever she can. As you all know, Carla is in operations and she is in charge of public health accreditation, and her actual title is compliance coordinator. She does a lot of other things. I'll get to that when I get to her slide. Emergency preparedness, Jason Gurian is presented to you all. He is a shared resource between public health and the rest of human services. Customer service, Kenda Griffin is the program manager. And that's the front of the house, back of the house, and a lot of the heavy lifting that happens to keep the building going. Finance is Mary Chicory. She's our program manager and finance officer for human services. Business processes is Katie Coffey, and that's a very short title for a lot of work that happens in that space. And program integrity and training is Dave Flaherty. He's a program manager. So there's Ms. Carla. Public health accreditation. Public health has been accredited from 2010, 14, 18, and 24. Carla did 18 and 24, serving as our agency AAC or accreditation coordinator, and Sarah backed her up in that role. She's also in charge of all of orientation and onboarding for human services. She does assign the universal homework, which is the work that we expect everybody to participate in when they come into the organization, so they have a broad understanding of what all the programs and services are on some level. Daniel Pena, who's also a compliance coordinator, is her backup for that. She also is in charge of routing all of the contracts, which is a massive lift in human services. We have lots of contracts that get routed through the system. She is considered our contract business officer for that function, and she does also work in RFP initiation and vendor engagement, which is not always fun. A lot of times she's tracking down signatures and making sure contracts are renewed timely and that things can keep happening as they're supposed to. She serves as the administrative hearing officer for program integrity. She's clerk to this board, and she assists me with RFPs, continuity of operations, and any other of the workflows that are in support of accreditation. Jason is a shared resource. One of the main functions he does is the Agreement Addenda 514, which is a public health function, and that's public health funding that pays for that. And all of the plans that are down here, I counted, there's many, then they go on to the next slide, are all tied to that AA 514. They have different timelines that are associated with them, but they all have to be they're regulatory and focused, most of them, and are time-based. Because we are adjacent to Charlotte, we're considered a Charlotte Readiness or City Readiness Initiative, so we get additional dollars, but to do all of these functions, we only get $46,702 from the state. So the county has to pick up some of the rest of the finance. These are some more of the associated requirements for the 514. He also supports the County Emergency Operations Center. Whenever they open, if there's a role for him to play, he does get called over to do that. He's in charge of the shelter support. We just recently had the shelter open, and he came and presented to you all. So he's in charge of recruiting the volunteers, training, implementation for shelters. He also does the functional needs registry, which used to be connected to emergency management. It's no longer a mandate, but we do it because it's best practice. That's where we reach out to the community and try to identify folks that if they were to come to the shelter, they would not be able to operate independently in the shelter on their own. So we like to try to know who they are, and if we can redirect them to another resource, we do so, whatever's in their best for their well-being in a shelter environment. And then he's also in charge of all the human service building safety plans. I failed to list fire drills, but he does fire drills, lockdowns, the shelter in place, anything in the building safety realm is in his bucket of work. Ms. Kenda and her team are in the back. That's Kenda Griffin and Dora Lisa and Amanda. They are the front of the house, the back of the house, and a little bit of everything in between. So Kenda has 16 and a half team members that she has in her shop. They do the mail, the dock, the courier. Anytime there's a room set up, which is often, they set the room up, break it down. They do meal routes for senior nutrition. They're in charge of the county, the fleet that are assigned to human services in this building, not environmental health, but just the public health and DSS fleet vehicles that are here. And Stephanie got a vehicle, so CSO's a vehicle. They also manage the shred contract, keep the building supplied with paper, and they do what we call navigation. So if you come in the building during business hours, someone will greet you, ask you what you're here for, and help direct you. Switchboard, they answer all of the calls that come in. They make any copies for the front desk, which is what keeps the client flow moving so people aren't waiting. And they do they back up our mailroom, and they also do navigation. The front desk and client relations, which is Amanda's team, she also has switchboard, I should have said that. They do check-in for all of the DSS programs. They assign them to a worker and to a space so that they can get that workflow going. And they do administrative assistant work, scanning, and they also navigate. Language support is Dora Lisa's team. They provide mandated language services to human service departments as needed, mostly covering DSS. They do have someone on call for CPS at night, so if CPS goes out and there's a need for an interpreter, they go out with them. But they can do any of the different departments. They also assist in written translation as needed. There's 4.5 team members. We have someone that retired and came back. So we have 4.5 folks that work on that team, and Dora Lisa. So there's a program manager, 2 human service supervisors, and 1 administrative support bilingual floater that she's able to go around and supports all the different needs. Mary Chicory is our finance manager who is in St. Lucia right now, probably having a nice beverage and forgetting about budget. Mary has accounting. billing, patient relations, and customer service. And those are what they say, payables and receivables. She also helps with, or her team helps with grants. The 1571, which is how we get reimbursement for DSS work that's done. The WORM, which is how the state reimburses public health. We do drawdowns for their funding. They support contracts, paying of all of our P cards, managing debt, and purchase orders, budget preparation, and management, which is a significant lift. There's 8 team members in accounting that work in that space. In billing, they do the fee schedule. When we bring you all fees, that's a collaborative effort between the public health clinical team and the billing team. So she manages the fee schedule. They do billing for clinical, dental, and lab. They support the cost settlement submission for Medicaid. They do reporting, and then they take cash payments. They set up payment plans, schedule the appointments, collaborate with clinical staff as needed to answer patient questions. There's 6 folks that do all of that. 1 is assigned to dental, and the rest are assigned to the clinical. Customer service, this is brand new. We're super excited about this. We transferred another position from another department in business ops, and this new position will be solely focused on debt. So when I talked to you recently about the bad debt and debt set-off, we'll be talking about this position. We'll focus on that as well as the program integrity debt. So there's 2 human service supervisors and a customer service supervisor in that space. Mary has 21 folks on her team. Katie's team is business processes. She has IT. Richard in the back is on Katie's team. They do IT support, help desk, procurement, imaging, deployment, asset tracking, hardware and software, phone support, and human service support in general for all of our systems. We have 3 information system coordinators that are focused on security and non-disclosure. They do the onboarding of our team members and making sure that people sign proper documents. They manage the HIPAA compliance and the investigations of HIPAA with the state and do HIPAA training annually. And vital records, we have 2 vital records clerks. They do birth and death certificates, which includes a lot of complexities with home birth registrations, affirmation of parentage. Oftentimes, these involve lengthy appointments with clients because there's a lot of information involved. And they support Tracy as our local registrar for vital records. They are her deputy registrars, and they can help with burial transits to move decedents across state lines. They help manage with our sub-registrars who do things after hours on our behalf. And all of these processes are time-bound and regulatory, so it's very important that we have folks that are well-trained in this space. Katie also has records management, which is all of the records in human services of all manner. That can be x-rays from dental all the way to just your normal patient records or client records. So they manage the security and retention schedules and timely disposition. So one of the things when she first took on this space we realized was that we had records stored and off-site that weren't being disposed of. So we had to bring those back in, go through them and set up schedules and make sure things were being shredded and managed on a timely, in a timely way and according to proper retention schedules and with proper state permissions. So she has 2 to 3 staff that work on and off in that space. She also has human service evaluators, 4 of them, and a business process manager, Cheryl Bowers, that manages that team. They focus on CQI, quality assurance, as well as data analysis. We did have a data analyst. Unfortunately, we don't have that position any longer, but they do collect a lot of data and monitor trends and set up dashboards. We have a lot of performance measures that we have for the county, but we have some internal, and we have a quality council that Cheryl's team leads in different departments. And Dave is compliance and training. Program integrity is one of his buckets. He has 4 program integrity investigators that investigate fraud mainly in our Medicaid and food and nutrition. And that's because those 2 programs have the most public assistance, and that's where the referrals come from. We can do it in other buckets, but that's where those referrals are coming from. They conduct those administrative hearings to validate or refute the findings of the team, and then they pursue the repayment of the fraud. That can be through an intentional program violation, an inadvertent household error, or agency error. And then they initiate what's called a voluntary repayment agreement that returns those dollars to the county, and then those dollars go back, some to the state and some to the feds, and we get to keep a small percentage of that. And then Daniel Pana is the compliance coordinator and training person that works in Dave's space. He backs up Jason as the preparedness coordinator. He helps with sheltering operations and training in that space. He also supports orientation with Carla and backs her up as the PI hearing administrator. And he also does, he's fantastic with creating videos. We have to work with public communications downtown to make sure that what we're doing is in line with what's needed and what's allowed, but he most recently did a lot of work at the opioid settlement videos with that program and working on that. So some of the special projects that we've done recently, as Ashley and Tracy talked about the child fatality team, Dave has taken on the role of the review coordinator for those. For that space, and has been able to help them tremendously in that space. The opioid settlement, several team members have worked in that area with facilitation, the videos, survey development, and data entry. Strategic planning, we work on the human service strategic plan every 3 years. The voice of the customer, we're required to do that by the county at the enterprise level. So we do that. Canvas team leads that effort out front with our clients. We're trying to get input from, it's a standard survey that we use for all of the clients regardless of program. And we try to get enough from each bucket so that we have some valid answers that we can work on. The human service continuity of operations, that was new. We each had one, but the county required a different look to that this year, so we worked on that in 2025. And then Laserfish form development and workflows is something that we work a lot to support across human services. Some recent accomplishments in our billing space, this has been a huge help. We had one certified coder, or two previously, counting the human service supervisor in that space. We have recently had 2 other ladies get certified as billing coders, and one person is now a public health certified biller. So that's many kudos to them for doing that. It's a big exam to become certified coder. In the vital record space in 2025, they were 4th in the state for efficiencies in processing our death certificates, which is huge when you consider there's only 2 of them. And we're competing with all of the counties, and some of them have much larger departments. The compliance coordinator training position, Daniel, passed his HC this year, which is the Homeland Security Exercise Evaluation Program. So he's now can conduct exercises with that certification. And then 2 of our human service evaluators earn their certifications in healthcare quality, so that when they do work in CQI or QA in public health and that side, they have that knowledge to fall back on. And they are all Lean certified, Six Sigma. So these are the performance measures that we're required to do that are associated with budget. Because of the nature of the work in business operations, a lot of ours are outputs and outcomes versus actual measures, just because of the type of work. We try to make them time bound so they are measurable. I'll call out just the one in IT. We had a 3 business day goal of responding to and closing all IT tickets, which is pretty good considering how large the department is. And they've done very well with doing that. They're on track for where we need them to be. We track how many contracts Carla processes. Most recently in 25, there was 126 contracts. This year she's already done 62. For the hours of language services provided in Dora Lisa's program, in 24, 5,747 hours. So that's a lot. We have all of her team speak Spanish. We do have one person that can do Russian, but that's not her full-time job. So the hours that you see up there are combination of interpreting and written Spanish. So far just this year, I don't have the number for this year. It's 1,527 for this year so far. If we didn't have that capability in-house, we would have to pay the contract line to do that service, so it's a savings of money for the county. The quality assurance team, They did in 25, 708 projects. They can be small or they can be ongoing. It depends on obviously the nature of a project, but that's a lot of projects with 4 team members and 1 manager. Program integrity, that's the dollar amounts that were brought back in through those repayment agreements. In 25, 91,866.42 was brought back in. That can be done through tax intercepts or just payments, even lottery intercepts. So there's lots of ways that we're bringing the dollars back into the community. Then it does get repaid. We don't unfortunately get to keep everything that comes back. In billing, we have a goal set to process all bills within 30 days of time of service. We have 180 days. We initially started with a goal of 10 days, and that was a bit aggressive, so we backed off of it to 30, and they do very well with that. The lead and lag measure that we've chosen to take on is a combination, or is in conjunction with the maternity clinic. And we were hoping to be able to get that off the ground earlier this year, but we had some staffing challenges, so we had to push that off. So we'll come back to that after we've had a chance to collect some data. But the intent of that was to kind of invert the way we were dealing with clients. So if it was a new maternity intake and they came in for service, there was a lot of paperwork on the front end that had to be done. So I'm just going to make an example. It was a 1:30 appointment. It might take my team 30 minutes to get them back for their appointment. And that messed up the integrity of the schedule. So to avoid that, we flipped the process. So we just check them in at the front, check with their demographics, and then they're able to get to their appointment. And then we're able to do the paperwork on the back end, which should help save some time and give the majority of the time to the provider. So just some stats and measures from 2025. Navigation, that's just who came through the front door. 94,429 folks came through the front door and were navigated, an average of 382 per day. The front desk checked in 28,209 clients, and switchboard took 21,070 calls. So there's a lot happening at the switchboard. The receiving dock, 6,312 packages. The drop box, so if people come after hours and they want to leave us some paperwork, they can put it in the drop box that will then get routed to the program or scanned in. And then 22,997 documents were scanned in by the team, and centralized scheduling, which schedules public health appointments. 2,238 calls were made and 3,008 voicemails were received and returned. So what are some of our challenges? To be able to support the needs across all of the departments. Every department that we support is important, and all the work that they do is important. So trying to balance those priorities and make sure we meet the needs is the best that we can to support them for success. Unfunded mandates, interpreting is an unfunded mandate, so we do have positions for it, but as that space and that need grows, so does the cost to provide that service. Our HIPAA risk assessment is a requirement that we do. We used to do it just for public health, but we've tried to do it for the whole of the organization, and cybersecurity obviously is becoming a bigger issue, and the cost of that, we went out with an RFP, and I think the cheapest one that came back was $90,000. So it's quite expensive to again, it's an unfunded mandate that's quite expensive. Increased complexity of client needs, which increases the complexity of the questions that the front team gets and that come through the calls. The impact of federal and state funding fluctuations on programs, and the evolution of our workforce. When people come and apply for positions, a lot of times one of the first things they ask is this remote? Well, no, front desk isn't typically remote. So there's, it's trying to find the folks that have the servant mindset to work in human services. Opportunities, the Human Services Academy is something that we're trying to get off the ground. It's been an initiative for a couple of years. We had some staffing changes when strategy and innovations came into play, so some of the team members that should have been able to do that weren't able to do so. So that's the idea of having human services team members understanding each other's programs better so that we can have more informed referrals and have more frequent referrals across programs. Meeting the escalating needs of preparedness, which a lot of them do require multi-departmental trainings and even countywide initiatives. So we have a responsibility in that space without the authority. But they may ask about what what is the ability for you all to respond to a certain type of emergency? Well, if we don't have that in the program, we can't necessarily assure it. So there's just those kinds of challenges. And then strengthening the recruitment and retention of staff by developing career opportunities with internships and succession planning. How can we keep the great team that we have challenged and engaged and growing and retain them, if not within operations, at least within human services, if not human services, at least Union County. And then continuing to work toward being a standard for success as a consolidated agency. That we really take pride in that and being the support that we need to be for the other divisions and departments. That's business operations. Bless you. Does anybody have any questions? It was a lot. Thank you for your patience.
I had a question on your stats and measures. Congrats to the teams that y'all are doing great.
Thank you.
This is 6 months in, right? It was July to December. So on some of the ones, there was a pretty drastic change, but there wasn't an expected target. Was that something that we did predict?
Can you pull that back up? She's asking about the stats and measures. Was there one in particular?
Yeah, so for example, like some of them are pretty obvious on the internal quality assurance. The target was 300, you're at 678 already, right? So that's an increase. But like the language, you know, it was down from 24 to 25, and then now if you were to double it, you know, it'd be a pretty significant drop again. Is that, but there wasn't a predictor on that? Just curious.
No, well, the language is on demand. So it depends on who comes through our door or what appointments are set. And what you see here is only the ones that we're providing. So in addition to my team, there's an entire separate team in public health that focuses solely on their clinic. They do the dental, but we do WIC. So we just never know who's gonna come through the door and what we're gonna be asked to support. And there's the language line, which is a contract language service that if it's a language we can't support, or if for some reason the team is already occupied, then we have to use the language line. So in addition to that, there's a lot of other interpreting that's happening.
Right. That's where I was just curious. I mean, it's not a bad thing. I was just curious because that's not the direction. We're not trending down as a county in that. So that's a pretty stark drop, right? Like if you figure, I mean, 30-something% drop would be anticipated. So, but we're going up as a county on the need for that. So
Well, it also, it depends too, we had to change, with when Dora Lisa came into the position, we had switched public health, took back over dental. And that was a big space that we had been doing a lot of work in. So with them carrying the dental, that decreased what we were doing in that space. And our interpreters also, they're admin 3s on paper, that's their title, and we did that intentionally because we want them to be able to grow and learn other things. So when they're not interpreting, they can be navigating, they can do switchboard and do other written interpretations, translations, as needed.
So it sounds like they're just in different places and, you know.
Yes,
Yeah.
they get, like I said.
There's not a decrease in the amount of people that we're serving, you know, that are multilingual. It's just different.
Dora Lisa, do you have anything you want to add to that?
Yeah, usually we have Russian, Ukrainians,
had a
and we can
huge
also,
influx.
yes, a huge difference right now. We have a lot of Portuguese coming, in other words.
I knew both were expanding.
We have other dialects that sometimes we have not, sorry, thank you. We have some other clients coming into our doors that they speak some other dialects that even in Spanish. We have experienced clients coming to our door like saying, I speak Quiche. And it's not, Spanish actually is their second language. So population language is growing, definitely is impacting our community and our services every day. We see a huge growth, definitely. And then we don't take it as a challenge. It's the way we are evolving. People are coming, people are moving from different places, and they're bringing our culture, languages, so that's the beauty. We wish we can have more interpreters like speaking other languages, but our biggest population is still Spanish speaking. But we do what we can. We serve our community. We're very passionate and we're come to, work every day and prepare for the unknown. We usually are not, our day can be from just not easy, but not challenging, and serving families, going out to CPSs and from navigating. It's just exciting. To me, it's from the time that I've been in this position, I am learning. We have a very good team, work family, and I'm still more to learn.
Thank you.
Yes,
Thank you for your work.
Absolutely.
I just wanted to make sure that everyone still had the access they needed. Thank you.
Yes. Thank you.
For that presentation. Next on the agenda, we're going back to Ms. Colley for the communicable illness report.
So respiratory measles update. So this will be the last one for the season since it's spring coming up. I'm glad to see that. I know you all are as well. So as of March 6th, the acute respiratory illnesses causing people to seek health care generally across the U.S. is now considered to be low, which is good. Influenza rates remain elevated overall nationally, with influenza A activity decreasing in most areas of the country, while trends in influenza B vary by region across the country. For RSV, the activity has started later than expected in most regions of the U.S., though severity is not higher compared to recent seasons overall. Let's see, typical season indicates that higher levels of RSV activity may continue into April in many regions. Emergency department visits and hospitalizations for RSV are highest among infants and children less than 4 years of age. For COVID-19, activity is decreasing nationally, but remains elevated in some parts of the country. This is just a graph showing respiratory illnesses in the U.S., percent of tests positive for respiratory viruses. You can tell it's starting to, especially flu, it's starting to trend downward along with COVID-19. This is a graph showing data for wastewater monitoring that we've talked about previously. Overall viral activity rates in wastewater monitoring in North Carolina are low or very low. Influenza and RSV, and low for COVID-19. Just know that Union County does not have a wastewater monitoring site anymore. We used to, we don't have that anymore. The closest one is in Mecklenburg County. Moving on toward measles, where we've had a little more activity. As of March 5th of this month, there have been 1,281 confirmed measles cases in the U.S. 1,277 of the cases were reported by 31 jurisdictions, and 4 measles cases were among international travelers. So, if you think about all the counties across the U.S., so it's really compacted into just 31 jurisdictions. There have been 12 new outbreaks, with 89% of the confirmed cases being outbreak associated. South Carolina, unless you're living out under a rock, we know that there's a lot happening in South Carolina. Thankfully, the rates are starting to trend downward for new cases. But overall, it's been a record-breaking time for measles cases in South Carolina. There have been reports of complications in South Carolina with infection, including pneumonia and encephalitis. Most recent outbreak totals there are approximately 990 cases. So really extraordinary. The rates that we have, that we report on, are updated by the state at noon each Tuesday. It's just a graph showing the weekly measles cases by rash onset date. You can see the some peaks in that curve in March of 2025. I'm thinking that's Texas. And then moving on towards March, January, December 2025, January, February is likely South Carolina. So measles in North Carolina now, you can see it's hard to see the graph there, but that's the state of North Carolina. You can see Union County represented there. Those are the counties that have reported measles cases. There have been 24 reported cases overall in North Carolina just since December of 2025. There have been multiple responses for exposure sites across our county and state jurisdictions. And one thing to kind of keep in mind is we're very close to South Carolina, Lancaster County, Mecklenburg. We're kind of all in that Mecklenburg County metropolitan area, and we're impacted by that. There's a lot of travel across the state, across county lines. So that movement of people makes us a little bit more vulnerable to cases. Want to remind everyone, Megan mentions this typically, the North Carolina measles data dashboard is updated twice weekly to reflect new cases and guidance that may have changed or been updated since the prior time frame. So that brings us to Union County. On February 8th, Union County confirmed its first measles case. A second case was confirmed on February 26th. Of that same month. Upon initial investigation, there's no epidemiological link to other measles cases on either occasion. This indicates a probable community transmission. There were no reported exposure sites other than medical facilities with that second case, where the patients were seen for medical care. We are in a position where we're encouraging businesses, schools, childcare facilities, everyone to be preparedness, using our surveillance and our data to help folks to prepare so that we can minimize impacts to businesses and lives, keep kids in schools, kids in childcare facilities. So on March 26th, we are planning to host a vaccination clinic for MMR. That's going to be in this room. So we're glad to be offering that to the community. We won't be doing titers at that clinic. We will be offering MMR to those that don't have documented proof of immunity. As I mentioned, and we talk about this all the time, we continue to work closely with the state and our wonderful community partners to share information and learn from one another as we're responding to these issues across the state, region, so that we can meet the needs of Union County and be more efficient and effective with our responses. These are resources where this data and information was pulled. These are live, so you can click on them if you have this information in your email with the PowerPoint presentation. Any questions or anything I missed, Ashley?
Yes, one question. Could you explain what the wastewater monitoring for respiratory viruses does? Like, how is it seems to track closely with the positive cases. What extra value does that give us?
So that gives us almost like a heads up that a virus is within an area or within a metropolitan area. It's a sign. It's another way of surveilling the data that can give us an indication. Hey, you've got measles in this area. If you notice, I don't know if you all are you may not be following the news related to measles as much as I am, but I recall when Mecklenburg County put out a news release that they detected measles in wastewater. It was a very short time after that they started having cases, and then we had our first case. So the assays for illnesses, diseases have expanded beyond just COVID-19. They can also look for measles in this case, which I think the science and the opportunities with that are very interesting and helpful in the public health realm so that we can be prepared when things like this, the diseases such as this come into our area.
Surge planning, like for hospitals, if they get a little bit of a heads up, they can start preparing for getting more cases, more patients in.
So I apologize. I thought I was silenced. I had to step out. You had said previously there was a testing site here in Union County, and there were two of them. Did they close because they were no longer valid? Is it a funding issue where they have no value as the population growth continues?
So initially, they were funded with ARPA funds, grant funding, and I don't know why, what happened with the funding, but I expect that the change was based on funding changes or some other decision that was made at the higher level. Janet, do you have any information on that?
I think that is correct, though.
And they were through a university, weren't they?
Yeah,
Like,
they were.
correct? Yeah.
In fact, all of them started in partnership with universities.
Right.
UNC Charlotte was the,
Yeah, that's what
yes,
I
ma'am.
actually think that funding may have initially been through something that had to do with CARES, like for the testing, that was initially how it was
the CARES Act.
approved, yeah.
Yeah, that's what I thought. I thought it was through a research project, which has taught us that this really is ahead and this science works, but hasn't circled back to us.
And again, it only measures what is being discharged into a public sewer. It doesn't capture septic systems and that kind of thing, but it gives you a little snippet of or a glimpse into what may be circulating in the community.
Thank you.
Great question. Any other questions for us? Thank you.
Next on our agenda, are there any announcements? We didn't have anyone sign up. Do we have any for public comments? Do we have any announcements?
I know I had a chance to speak earlier, but I have a couple of other things that I would love to hear. Stephanie, do you have anything? So two things. One, the Union County Board of Commissioners is having its FY27 budget retreat this coming Thursday from 8:30 a.m. until 1 p.m. That will be held out at Cane Creek Park, but it will be live streamed on YouTube. And so since that ties to all of the work, you all may be interested as part of this, as well as just as part of your role as Human Services Board, as well as just residents of Union County. And the second thing is I wanted to say that I had the chance this last week to visit with several of our congressional offices to advocate on behalf of transportation and in partnership with the North Carolina Public Transportation Association and Community Transportation Association of America. And we met with the FTA and had meetings with a number of different senator and representative offices, including Mark Harris's office, who's obviously here, as well as Ted Budd and Alma Adams, so some very local entities as well. And we were advocating for all of the national priorities, but really North Carolina specific ones, which some of that is funding in transit and some of that is just reduced regulatory reform and reduced administrative burden. And as a part of that, I was able to share a video that one of our shining stars, Ms. Teresa Torres, who is the Director of Transportation, was able to help facilitate. And you might recall that either at the last meeting or meeting before, Teresa mentioned that our transportation team was highlighted in
a magazine article recently, which is actually referred to in what I'd like to show you. If you'll give me just 2 minutes to make that happen. Are we good with it, Richard, do you think?
Yes.
Great. So Richard's got something queued up, and it was kind of cool because WSOC said they wanted a positive news story for a change, and so they came out about 2 weeks ago roughly, and you'll see what they did, and I think it's just a nice highlight for some of the good work that we do, and that is supported by everybody from Jackie's team in part, just really all across the county, and Teresa and her team just knock it out of the park, and as does everybody else in Human Services. So I'm really proud of this and really proud of the ability to serve, and just wanted to share this with you guys.
Covering Union County tonight, more people are hopping on buses just like this to get where they need to go without paying a dime. The service is now so popular, the county wants to expand, making it even easier for people to get a ride.
Our Gina Esposito got on board with a woman who says she relies on the buses to get where she's going.
This is Judy Kinlaw. Oh, I got my wheels on right that time.
I love it.
That's what you were doing. Like I've done this once or twice. She started riding the bus 4 years ago. Last bump. After an accident left her wheelchair bound. She says she left Charlotte to move in with family in Union County and need to find a way to get around on her own.
It's a one phone call deal to sign up for it, and all I have to do is remember to call in and schedule my appointments, and I'm ready to go.
Kinlaw says she uses the Union County bus to get to doctor's appointments in Charlotte and Monroe, but also to go shopping and get a haircut.
You know, it really helps me feel more independent, more in charge of what I'm doing.
Union County's bus system is open to any resident of Union County. It has a fleet of about 25 vehicles that make more than 400 rides a day. It goes as far as the VA in Salisbury and is free for most riders. About a year ago, the county saw a need to serve families with young children. So now parents with children under the age of 15 can ride the bus, and you can see they have seat belts, or you can even put a car seat in. Recently, the transportation system was featured in Business View magazine for its investment in the community.
Well, we have grown by 10% in the last 3 years of our ridership. We've increased our vehicle size, and just having more funding available has allowed us to do that and help more people.
Teresa Torres is the transportation director. She says they're working on ways to improve the system and expand. That includes a new software system coming soon, so riders can make same-day appointments through an app. Right now, riders have to call 48 hours in advance to book a ride.
I'm all for that.
Kinlaw says that change would give her more flexibility when booking trips to and from her house. But for now, she says, the system works.
So I can make my own schedule, make a phone call, the bus shows up on time. And the unique thing, I think, is after riding for 4 years, I have never been late to an appointment.
I think that's it. I appreciate you seeing it.
In Union County, Gina Esposito, Channel 9 Eyewitness News.
The transportation director says next year they plan to get more feedback from riders about how to expand the bus system. Right now, there are no bus stops. All riders must register to ride and have to book an appointment. The idea of creating a 5-year plan would help determine how this transportation system can grow.
Autographs.
That's awesome.
I have no update.
No, anyone else?
Hello. I have just 2 quick things. I wanted to mention that the Veteran Service Office has been given grant number 2, which is awesome, for $20,000. The first grant was about $18,000, and we purchased really nice client chairs. We got a scrolling display system in our lobby. We got audio visual equipment. We got flags. Jackie, we got flags. And so we're excited about grant 2. And with that grant, we have designated it to we had to provide a scope of work, and one of the scope of works was to have an event. So we are planning an event for veterans on Saturday, May 30th. It'll be like a resource fair. We're gonna have a walk through the trail by the Simpson Event Center. So I'd love for all of you to come if you're able to make it. But in true fashion, I promised to give an updated great story. And I have notes that don't even make sense to me. So imagine how a veteran might feel trying to explain or navigate the VA system. But in essence, this Vietnam veteran it's so difficult to explain sometimes, but the VA adds new rules to the disability list. And as some of you may know, the Agent Orange toxic exposure list was expanded and added heart. So they went back and reviewed files, and this gentleman had filed previously for a heart condition, served in country in Vietnam. And they gave him an initial retro payment of $32,700. However, we did not feel like that was sufficient enough because it went back to 2002, and from 2002 to 2025, his heart condition had substantially increased, gotten worse. So we provided medical evidence to show that it had substantially gotten worse, and therefore he was awarded a supplemental claim, and so the total award was $537,072.02. Woo!
Nice.
Yes.
That's awesome. I have a question on the expansion on the Agent Orange, but I can ask it afterwards. I didn't know if the expansion included any of the descendants.
It did not, it was just crazy.
Yeah.
Thank you.
Do you have anything else? Is there a motion to adjourn?
And the certificate.
Motion to adjourn.